Hey everybody, Mayor Jane here, and I am here with my good friend and physician extraordinaire, Dr. Jason Wilson from Tampa General USF Health. How are you today?
I'm doing good, Mayor. I'm
Good.
sorry every time we talk, at least
I know.
professionally, it's always the last year or so about
Right.
about COVID,
Right,
not about the
right.
lightning or the bucks.
So give us good things, the
Yeah.
lightning in the bucks, but let's talk about COVID and what we are seeing right now. We really thought we were in the clear, but that's
Yeah,
not the case.
I now I'm having deja vu, basically, of what I was probably doing this time last summer. I'm essentially doing the same thing right now. So we're kind of in the same spot we were in a year ago. We're seeing a really big, rapid shift in the types of patients with COVID, the types of patients coming into the hospital, and the hospitalizations. Hospitalizations have really gone up in the last week and a half to 2 weeks. We were at about 15 patients in the hospital just 2 weeks ago. Now we're closer to 80 patients in the hospital. These are mostly people who are younger. Remember last summer we were thinking of if you were young, you probably didn't have very serious symptoms of COVID. Maybe you had COVID, but you just stayed home. It was older people we thought of getting hospitalized. That's not really the case right now. The average age of our hospitalizations is people in their 40s.
Oh my goodness. Wow. And then also to put into perspective, so we were looking 65 and above before. So now we're looking in our 40s for the average age of people coming into the hospital. And then also the numbers. I mean, at the height, it was 80 to 95 patients a day, and now you're really back up to that number.
Yeah, we're in a surge again, and here's the difference now. Before we thought about all these comorbidities, other things that you might have, older age, diabetes, overweight, lung problems. Now the comorbidity, the risk factor for getting this is not having a vaccine. That is the comorbidity, is not being vaccinated. So by far and large, the patients who we're seeing get sick and get hospitalized from COVID, they're mostly non-vaccinated patients. Our vaccinated patients are definitely getting some protection, either against getting COVID, against getting hospitalized from COVID, or then getting seriously ill even if they are hospitalized from COVID.
Wow, that's that if that can't underscore the importance of being vaccinated, I really don't know what could. So let's talk about this Delta variant, because
Sure.
that really is what has caused this to reemerge with such force. And a lot of it goes back to the lack of vaccinations. That's what's allowing this Delta variant to spread. So before we talked about the possibility of getting COVID. So if you're unvaccinated, what would you put the percentage at of you contracting COVID?
Yeah, here's the bottom line. If you don't have a vaccine, you're going to get COVID. You're going to get the Delta variant or some other variant we haven't even imagined yet. We're just going to keep on having the same conversation over and over and over again about variants, about increased transmissibility, about increased infections until we get those vaccine numbers up. That's really where we're at right now. It's either get the vaccine or we're going to get COVID. That's these strains we're seeing are just becoming more virulent, becoming more infectious. They transmit so much easier. And now with everybody kind of returning back to normal life, you're around each other. We're not doing as many social mitigation strategies as we were before, and we've got very low vaccine numbers. So basically what's going to happen, unvaccinated people around each other are going to get COVID.
Right. So the bottom line, get vaccinated or get COVID. Those are the choices right there. Now, what about kids? We're getting ready to have school back in session, and that, those classrooms in themselves could be super spreaders.
Sure. So a couple things to remember about kids. First of all, remember that kids 12 and over now are eligible to get the Pfizer vaccine, and some other vaccines may open up for those kids as well. So just so people know, I did get my 12-year-old vaccinated. As far as I know, he seems to be doing just fine. We played basketball this morning, and he seemed okay. And he's off at camp. So these vaccines to be safe in kids as well and effective. Now, kids under 12, we don't have a vaccine available quite yet, but one may be coming pretty soon.
Okay.
So we're all watching that very closely to see if vaccines become available for people under the age of 12. Now, what we're going to start to hear a lot about is whether or not we should wear masks in schools, how we do social distancing in schools. One thing to always remember is no matter what kind of happens with policy, remember most of us own masks now, and we have masks, and they're highly effective. So don't forget, you can always have your kid wear a mask, or you can wear a mask. At bottom line, they are very effective at preventing COVID, so masks do work.
Okay, so let's talk about the vaccine. Some people are hesitant because they feel that there haven't been enough tests or whatever reason with the vaccine. So you and I talked earlier, And I thought it was wonderful the way that you put it about the individuals that were coming into the hospital and what they were presenting with.
Yeah, you know what I mentioned to you was that no matter what's going on politically, no matter what's going on in culture, the reality is that people come to the emergency department with the things that are bothering them, that are hurting them, that are happening to them, and there's nothing that can stop that. So me seeing lots and lots of patients, I'm gonna see what's actually going on in our community. And what I have not seen, Mayor, is people coming in with serious side effects of vaccine. Now, it doesn't mean we never hear about one off, thing that's happened maybe because of vaccine. It means that we don't see any pattern, any large number of people. I've never taken care of a patient with a serious side effect of the vaccine in this entire period of time. That says a lot because on the other side of that coin, I've taken care of lots of patients with COVID, and right now I'm seeing a lot of people who are not vaccinated get COVID and get hospitalized. So when we calculate those risks, right, vaccines prevent COVID. Vaccines are not causing serious side effects in the vast majority of people who get vaccinated. And COVID, we know, is so transmissible right now and certainly does have quite a bit of serious side effects with it. People really need to remember this when they balance that risk profile. The other thing, these vaccines came out back in December. They were under what's called an emergency use authorization from the FDA. That may change soon. They may be fully authorized soon. But either way, remember that at this point, while there was maybe not as much data then, there's millions of people who've had the vaccine now. There's more people who've had this vaccine than have taken some medicines that are on the market.
Yeah.
So if there are going to be side effects, I would see those side effects. Those patients would come to our hospital and we would see them. We don't really have any vaccines in history that have made it out this long that have had serious side effects and had to be recalled or had something serious happen to them. So we're kind of in a place where we just don't have any precedent that there's something serious happening because of these vaccines, other than that they're saving lives.
Yeah. And although you and other physicians have come so far in the treatment of COVID and you've been able to save so many lives that were lost in the very beginning when there wasn't as much information, people are still dying from COVID unnecessarily.
Well, that's the key too, is every life lost obviously is tragic, but if you go back to March 2020, we were doing the best we could. Everybody was doing the best they could. Now we get to where we are right now, we really don't see deaths in people who've had the COVID vaccine. So essentially every life that's lost to COVID now was a preventable death. I mean, a fairly easy to prevent death. So it makes it even so much more tragic and makes this message just so much more urgent.
Another misconception out there is you're young, you're healthy. Even if you do get COVID, what's the big deal? Unless you're elderly, what's the big deal?
Yeah, we really concentrated on people who were older, who had comorbidities last summer, into the fall, into the winter. Average ages were, closer to the 70-year-old mark or older. But what we're really seeing right now are people who are much younger, people who are in their 40s make up our hospitalizations. Now, what's important to remember with that is, again, the number one risk factor for protection or for getting sick is vaccination. Because the people who are vaccinated, they're not the ones who are ending up with oxygen support or a breathing tube, or requiring even more special type of medications to help them with COVID. It's the people who aren't vaccinated who are mostly requiring that intensive care, the ICU level care. That can be young people, older people, people with diabetes, no diabetes. It's really vaccination, no vaccination is what predicts that best. Now, it's also important to remember that if you're vaccinated, you will likely stay out of the hospital. And what's interesting about that is we have another treatment for people who are out of the hospital too, and only available to people out of the hospital, and that's these monoclonal antibodies people have heard of by now. And those have become much more widely available because of some changes to the FDA. So people who are vaccinated, who get COVID, who are not in the hospital are eligible for those monoclonal antibodies, which is interesting because the data behind those is that they also prevent hospitalizations.
Oh.
So you get like this double-edged shield even if you do get COVID. Now, it's not to say you're not eligible for those antibodies if you don't have the vaccine. You certainly are, but the likelihood of you being hospitalized is also much higher for those patients.
That's right. Well, I think the bottom line is the vaccine is safe. You have a responsibility to get a vaccine, not only for yourself, but for your family and the rest of the community. These variants are developing and spreading because there are still people that are not vaccinated out in our community. So we can't say it enough. The vaccines are readily available. They're free. The only place they're not available is once you contract COVID and you present yourself in Dr. Wilson's emergency room, then it's too late.